Thanks everybody for coming. Really appreciate this opportunity to speak to y'all. I have to say I'm a little more intimidated than the normal crowd that I speak to. Most of the time I'm speaking about cybersecurity and people don't know anything. Or I'm speaking to attorneys who are even worse than that. So hopefully today, I'd like for today to be a conversation. I've got a bunch of things that I want to mention, but if at any point along the way anybody has any thoughts, experience, exposure to any of these issues, please by all means interrupt me. I won't be offended. And I am recording this. I figured since we're talking about webcams, I might as well have one here. So I'm going to record at least myself. It's facing this way, so for any privacy-minded people who don't want to be recorded, I can edit you out. But you are being recorded right now, so we'll get into some of the legalities of whether that's a problem later on, right? So I do want to start off with a kind of a little background story about how this topic really is something that I think a lot of people need to know about. We had a client that they're located, let's say, a couple of states away, and the client has a family member that's located here in town. They're at a nursing home. They're getting a lot of complaints from the family member that they're being, treated badly. And so they came to us. The client comes to us and wants us to see what we can do to help. And we start talking with the person who's in the nursing home here, and we find out that this person has like a diminished mental capacity, right? So they're not totally reliable. It's not clear whether that person, really is being abused, or people are doing bad things, or whether they're, with dementia, like imagining that some of this stuff is happening. So increasingly, the problem becomes the family member out of town gets really concerned about what their family member is experiencing, here locally, and so they start calling, bothering the healthcare provider, calling the office, calling the staff people, calling the caretakers, and it really gets to a point where it's disruptive to the patient care, right? And so at some point, it's good to keep track of your family members, but at some point, you really are causing problems. This client was calling in the middle of the night, and the person would be asleep. Caretakers would be asleep. Now you're waking this person up. They don't know where they are. They're lost. So it's really causing problems. And so we started thinking, how can we, short of, beaming this person literally to Jacksonville, what's something we can do to help them feel like their family member is okay and that they know it? And this actual webcam was one of the webcams that we ended up taking and putting in this nursing home facility. I only did it myself, so took a look at the legal risks and consequences before we did that. But what I really found out that we put the camera in, one in the living area and one in the bedroom. Not anything in the bathroom, not in any area where there was, there's changing that goes on in the bedroom. But when we went we started thinking about what permission, if any, do we need from healthcare provider? Are they going to let us do this, or are we just going to be in a lot of trouble? And we looked at the lease, we looked at a lot of the documents. We couldn't find anything that told us we couldn't do it. There's no state law that we knew of that said you can't do it, other than some of the stuff we'll talk about in a minute on recording audio. And so we put these two cameras in, got it connected to the internet in a secure way, and we're able to get the family member access. And what we did decide is we were going to tell the caretakers, because they're there too, they're living there. They wouldn't have otherwise known if we'd have just taken a little spy cam and put it in there. That might have been a problem for any number of reasons. Even if not criminally, they might have caused problems. So we had good caretakers. We didn't want them to be upset about everything, and they were telling us that they were doing a good job, and we kind of believed them. So set these cameras up. they were happy to have some kind of monitoring where this person, this family member remotely could call, or really, they didn't really call. This does have a feature where you can turn on the audio and speak remotely, but there's no button on this end of it. So if you're the patient, you can't call the person, family member, but they can kind of jack in and start talking, and you can talk back to them. But we really found that solved the entire problem. With people knew that it was there, so the caretakers that were involved, they were able to say, look, here's us doing our good job. You don't need to call us at 2 a.m. You don't need to call us at 4 a.m. You don't need to, bother us throughout the day when we're trying to take care of your family member. You can just turn on the camera. And it really did work wonders. All that family member did was want to know that their loved one was okay. And they checked a lot. But checking a lot on a webcam was minimally invasive and bothersome for everyone in that room, including the patient, including the person that was there, who couldn't, and sometimes didn't understand why their family member was calling, bothering them so much too, even though they were complaining about the problem. So I provide that example because I think my first instinct would be to say, this is a horrible idea. There's so many risks here. There's so many problems, so much liability that could result from setting this up in a hospital room or a nursing room. And no way in the world, should you ever try something like that, because it's just not worth the risk. But I really have seen it from the other side, and I've seen it work and have it solve a problem. So I guess my pitch to everyone here is, I know there's lots of people who probably do this all day and probably share the risk concern that I have too. But I really have seen it work, and I do think there's possibilities, there's ways to have webcams work in a healthcare setting in a way that can be productive, and really the goal in healthcare is patient care. And so keep patient care in mind rather than minimizing risk. Sometimes I feel like the attorneys focus more on minimizing the risk than the patient care, right? So if everybody is a little bit flexible about how we're doing it and how we implement it, I think there's a lot of different opportunities to make this work. So with that, I'll switch to my first slide here. I picked this picture because I feel like this is kind of the approach that everyone takes with these cameras. If you're the healthcare provider, you really don't want to talk a lot about this. You don't want a bunch of people bringing their nephew in and setting up Nest cams in all the rooms. You even might be wary of putting something in your contract because people might object to it or might find a way around it. And so I feel like a lot of healthcare providers are just simply doing like let's not talk about it, let's hope people don't do it. And if they do it, maybe they do it wrong. If they do it in a way that gives us legal recourse against them, then then maybe you got them there. So not all healthcare providers are thinking like that, but I know that the simple solution from the healthcare perspective is let's not do this. It's kind of like the Supreme Court. We're not having video in the Supreme Court, even though lots of other courts have video in their courtrooms. U.S. Supreme Court still holds down. So easiest solution on the provider side is to say no. The patient side, I think a lot of times people get in their head that something has gone wrong and we really want to catch these people doing something bad. But when you think about that, that's not really, you don't really want to have one more incident where there's something bad that happens, right? So I found in our experience with our client and their family member that there's a deterrent effect. If people know that they're being watched, for better or worse, they're going to hopefully act in a way that reflects that they know that there's proof of what they were doing and how they were doing it. And so I feel like sometimes people feel like something's wrong, their family member's being mistreated, or they're being mistreated. We're going to do some secret webcam and install it here. And what they end up doing is doing it in the wrong way, doing it in a way that violates any number of laws. And then, even if you've got proof under Florida law, you can't use it because you did it illegally. So the middle ground, I think, is kind of doing this stuff openly, informing people about it, getting their consent, and then doing it in a way when everybody knows about it, rather than people trying to either ignore it and not do anything, or do it in a covert way that ends up having consequences that you're really not wanting to have. Really, if you do something illegal, usually you could have civil liability as well. So you don't want to end up being sued for when someone is abusing your family member, right? So I wrote down in my preparation here, there's no magical way to do this in every case. I can't stand up here and say, all right, here's the configuration and here's the software, this is how you do it. I think you really have to deal with each situation, kind of as it comes to you. Different settings have different levels of whether this is appropriate or not. And so I think you really have to kind of go through. We'll get into that in a minute here. Now I want to talk a little bit about the legal issues. And since we've got such a qualified group in the room here, I'd like to take a survey and get your thoughts on a couple questions, and I'll tell you what I think the answers are. Maybe if you have a different opinion, let me know. So first question for those in the room, let me get a show of hands. Is recording a video without sound of someone, even if you don't have their permission, is it legal to record video without sound of someone in Florida? Does anyone think that it's okay to record video without sound, without permission? Only one person, really. 1.5.
I'm on the fence.
So,
I want to know the answer first. I'm on the fence.
so there's, it depends kind of. So maybe that's what you're thinking.
Yeah.
But this case right
do you have
here.
to have express
Is it an
consent, or
employee?
can you have like implied consent if they enter your physical space?
Or is it in a work setting too?
So let's cover all those points. So this case, Minotti versus Baudo, generally stands for the idea that you do not need consent to record video only. Okay, if you're recording audio and video, now you got a problem because there's a different statute. But generally speaking, if you record video, in this case, the people were trying to use the video as evidence, and people were complaining, saying, "Oh, I didn't consent to being recorded. You can't use that evidence against me." The court said, no, there's nothing inherently wrong with recording video as long as you weren't recording audio. Now the caveat to that is there is a Florida statute 810-145, which is the voyeur statute, which basically says you can't take video of people in really a couple of different situations, but basically changing clothes, where they're not going to have, where they would have an expectation of privacy, or if there's some kind of sexual situation going on. You're not allowed to record people in those kind of situations without your consent. There is a carve-out even under that statute. The exception is if the camera is installed in such a manner that the presence of the device is clearly and immediately obvious. So if two people decide to do whatever they're going to do in front of a camera that's, somewhere where everyone knows there's a camera, that doesn't cause the camera operator to trigger the voyeur statute. So that statute is designed to keep people from doing creepy things and from using the video that they might have. There's a distribution provision in that too. Even if you didn't create the video, you're not allowed to traffic it, sell it, post it, do anything with it. So generally speaking, video without sound is okay. So now let's switch to voice for a second. Let's say, does anyone think that recording a conversation of someone without their consent, an oral conversation, would be illegal in the state of Florida?
Illegal?
Illegal. Is it illegal to record someone's conversation? Yes. I'm seeing a lot of hands, and you're right. The Florida statute 934.031A says it's illegal. It's a two-party consent state, right? Every state there's different variations on that. In Florida, there is an exception for if you don't have a reasonable expectation of privacy. So if I'm at a baseball game and I'm recording the Little League team and it's got audio and video, I'm not violating that Florida statute at the baseball field because no one as an expectation that there's going to be privacy. In fact, you probably see people recording at shows all the time. Now, it gets a little trickier to talk about like a workplace. Think about this room right here. Do we all have an expectation? Well, I told you I'm recording it, so that doesn't work, right? But forget, let's say I was covertly recording. Do we think that we would have a reasonable expectation of privacy in this setting? I think that's a lot more gray. What's not gray is if I take someone and go to my office and have a private conversation, even if we're not talking on the phone, even if I've got the door open, if it's the two of us and I'm not telling them that I'm recording that conversation, I got a huge problem. So, A, it's illegal to do that without all parties consenting. B, this statute right here, 934.10, gives a civil cause of action. So, if you record that conversation, think about it back to the healthcare setting, right? Someone goes in and records audio of someone yelling and screaming at an elderly person, clearly abusive. If they've recorded that and did it without permission, now potentially either the organization or that person doing the abuse has a civil cause of action against the person that did the recording. I don't know what kind of damages you're going to get, right? If that's your evidence, hey, this is me abusing someone. But the other thing is that there's an exception in the Florida law in the evidence code. You can't use illegally recorded audio as evidence. So if you tried to sue that caretaker for abusing that person, you're not getting in your audio that you've illegally recorded. So it's different than that Minotti case, because in that case there was no audio. So for people in Florida, if you have concerns and you don't want to tell the person that you're going to record it, I think you should. But turn off the audio. And we actually did that for a time with the cameras that we had for our client. Turned off the audio completely. So it was taking video. And really all our client wanted to know is this person, is my family member okay? Are they awake? Are they not? Are they even there or not? And so the audio really wasn't something that we needed to get. And by turning off the audio, we eliminated the need to have caretakers sign off and consent each time. Because logistically that gets difficult, right? If you're somewhere remote, how are you going to get all these people to consent each time they come in? You have to keep getting consent. What do you do about visitors that come in? I'll touch on a couple of those issues in a minute, but the consent thing gets really kind of difficult. It's better you don't have to get consent to do it in a way that still accomplishes your objective. So let's see. So let's talk about the Granny Cam situation. In a healthcare setting, is using a webcam in a healthcare setting a HIPAA violation? Anybody think that using a webcam is a HIPAA violation in a nursing home?
Depends.
No one? No one thinks that that's a problem. So
Yeah, I mean, if you're recording a patient,
it depends, right?
Yeah.
So from the patient's perspective, they're not covered by HIPAA, right? They're not a covered entity. They're not a business associate. They can put whatever webcams they want in the room. Now maybe there's like the issues we just talked about with recording. You got problems. But in terms of HIPAA, not covered, not affected at all. No remedy, no recourse, no nothing. On the flip side, the covered entity, if you're the healthcare provider, you most definitely are covered by HIPAA. But there isn't. Tell me if anybody knows differently. There's nothing in any of the HIPAA laws or in the regs or any of the guidance. There's lots of different layers to all of that. There's nothing that says you cannot use webcams in a healthcare setting. Right? And you're seeing webcams being used pretty frequently now with telemedicine. Right? So there are ways that people are doing this in a HIPAA compliant manner. But there's lots of ways that things can go wrong. All right, so under HIPAA, you've got the two big things. You've got the privacy rule, security rule. I don't need to go into all of that for all of you. Privacy rule, generally you can't make unauthorized disclosure of people's protected information, health information. So that's pretty clear. If you got a camera, if you're a healthcare provider, you got a camera in a room and people are getting access access to that video feed that the patient is not authorizing, got a privacy rule problem. I feel like the privacy rule is easier to think about. The security rule is a little bit more nuanced. There's a lot more components to it, right? You've got, under the security rule, you've got to have administrative, physical, technical safeguards that ensure the confidentiality, integrity, and security of electronic protected health information, right? So let's walk through those in a little more detail and think about those. So administrative safeguards, the biggest and easiest one, the one that all the regulators ask about when you come in, is your risk analysis. Did you go through, when you decided to put that camera in that facility, did you think about what the risks were? Did you document them? Where is your documentation? How did you deal with the different issues? And I don't want to get into all the details because it varies depending on how you have it set up, right? But if you're going to do this, and if you're covered under your business associate, you better be doing a risk analysis ahead of time, and you better be documenting it. Because the first thing, y'all probably already know, the first thing they ask for is, let me get a copy of your most recent risk assessment. The second thing they ask for is your incident response plan, and did you follow that, right? So if you don't have some of that basic documentation in place, you're really going to be, and I've seen it, where regulators come and start asking for questions about documents and policies, and people are deer in the headlights. I feel like I've seen it. I haven't seen it from a client perspective where I've had to deal with it, but like a lot of people are putting these Amazon Echo devices everywhere, including in medical situations. And you could see it happening. Family member brings in an Alexa device into a nursing home, puts it in there. Right? Once the organization knows about it, are they, by knowing about it, are they consenting to it? If they're allowing it to connect to the network, do they have some kind of responsibility once it connects to the healthcare provider's network? Where is that information going? There's lots of different issues there. So circling all back to risk analysis, you got to have that risk analysis done in order to meet the administrative safeguard. Physical safeguards, it's a little easier to think about. That's part of why I have the camera here. Right, you've got the camera. It's pretty simple. You've got a power cord. Some of them don't even have power sources. It's just a camera, and it'll have a battery that lasts a year or more. And some of them plug into a wall, and it looks like something, and it looks like a battery charger or a power charger, but it's really a camera. So power cord really doesn't concern me that much physically. Tell me if anybody disagrees with that. My bigger concern, physical safeguard-wise, is you're beaming that signal to a network, right? It's going through the air to a network that's receiving it, and then what's it doing from there? Whose network is that? Is it a public network? Is it protected? How many other streams are all going into this network? Is it encrypted when it's traveling from this camera there? I think a lot of the cams really do a pretty good job of encrypting, but a lot of the cheaper ones don't. And that's how they're cheaper. So the key, going back to like your risk analysis, somebody should ask, is this signal that's being beamed, is it encrypted? If someone were to intercept it, do I have a problem? And then kind of go down the line from that network, right? Once you're on a network, who else has access to that network? Can everybody that's at the hospital or the nursing home, are they all sharing that same network? And could someone that really wanted to use that network to then backdoor into each camera? Because that can quickly get into, from a one-person scenario, into if you've got 1,000 rooms or however many, and how many days does that go on? You just, you hit the maximum HIPAA fines pretty quickly. So physical safeguards, I think, are critical. And the other thing, too, with these cameras and a lot of the Internet of Things devices is they don't get updated very well. There's a lot of patching that goes on servers. There's a lot of patching that goes on for even medical devices, right? But the cameras and some of these other things, they don't get any updates at all. All it takes is for somebody to, every device has a vulnerability that's just whether someone figured it out yet. And it can be fairly easy to get on the dark web or somewhere else, figure out what kind of vulnerabilities a Nest Cam has, and then take advantage of them. So if you're a healthcare provider and you're putting these cameras into your facility, you need to make sure that part of your documentation includes making sure that those devices are up to date. And finding out, making sure that you have a way to know about vulnerabilities as they come about. So some of that's just thinking ahead, planning ahead, making sure that you've got the information you need to make sure that you're not opening up a huge problem. Technical safeguards, the one thing that stands out to me on this is, think about the family member that's getting that video feed, right? What happens when the room changes? The patient leaves, new patient comes in. Does the family member from that former patient still have access to that video feed in that room? That could be a huge problem. So you need to make sure you've got ways, the software that you're using limits the access of people that you're giving it to, that you've got ways to turn off and on that access. I feel like what I've seen that works the best is some of these tools that healthcare providers use for telemedicine. They're very good at being able to control when and how the cameras are on and off, and to eliminate user access after a certain period of time. So that's just something to really think through. If all you're doing is putting in a bunch of Nest Cams, that is in no way going to fly under HIPAA, because there's no way you can control the amount of access that people are getting. And the other thing to think about too is the retention of that data, right? If you have a Nest Cam, I think that might set to record for 5 days before it loops over. If you have patients that turn over during that 5-day period, now you've got video. If it's the Nest Cam software you use, which hopefully you never would, but if you did, you'd have all kinds of information from other people in that same video feed. If you're giving access to other people, now you got a problem. One way I have seen, maybe this is just a quick dirty fix, but every time you connect one of these Nest tools, Nest Cams, you can reset it, and when you reset it, it clears out the video from the previous, that the camera recorded before the last reset. So I don't know that that's the most secure way, because you really can't be sure where that data went, but in a pinch, I feel better about that than nothing, or can just leaving the data there, right? So I think those are some of the issues that I see under the security rule and the privacy rule, but I'm curious, does anybody in the room have any thoughts on other things I've missed or things to think about? I've got other stuff to talk about, but I figured I'd pause here and see if everyone...
I'm just curious too.
Yeah.
I mean, we happen to be going through this with my mother-in-law, so
Yeah.
it's kind of an interesting. But the family members went to a lot of facilities and filmed.
Mm-hmm.
This is what the main room looks like, and I, being kind of privacy real, I'm like, there's a lot of people in these videos that you're taking as you're walking around on these marketing tours. That they're, with audio, with video, and so forth. Now, I happen to be out of state, so hopefully it's a little different, but it's challenging. I mean, what's your thoughts on kind of the overall, the ability of people now with phone cameras and everything to, to go through these facilities and pick up, individual images and things like that?
So I guess it's hard to say. I don't want to give a legal opinion on something.
Just more for discussion.
Generally, I feel like people are increasingly aware that everyone has a camera and everybody's recording pretty often. And so, to me, that threshold of when you have a reasonable expectation of privacy is at least for now, going down. Now, if everybody adopted California's law, maybe we'd swing back the other way. I feel like there is a huge difference. That's a topic for a different day, but between what people think in Europe versus here. People just have a totally different level of tolerance for their privacy being kind of invaded or waived. But everybody's fine with it until it's something that they really care about, and then suddenly they become a privacy advocate, right? Oh yeah, how dare you? I've been posting stuff for 6 months online, but now I'm really worried about my privacy. So I think if you're just walking around a facility, if you're not going and filming people's charts, I don't have a whole lot of concerns, especially if you're just a person walking around. You're not bound by HIPAA. You're not, that's not going to subject you to anything. The biggest thing might be the facility.
Yeah, that's more what I was
Should they come in at some point and not let people film? I think if I was advising the facility, I'd say, yeah, don't let people walk around with cameras. You should tell people when they come in the door, this is a medical facility. Right? Privacy is important to us and all the people in here. And for the sake of that privacy, please don't use your camera. And if you do, we're going to reserve the right to take it from you. I don't know if that legally you could do that, right? But sometimes you put those kind of warnings out there, hopefully as a
Yeah,
deterrent.
I mean, I could see the facilities going to a point where they say, look, we have marketing videos that you can share from our facility website that show you all the amenities and all the things that we have, but, as discretion to our patients and privacy, you can't walk around with your phone camera and just film everyone in our facility. I knew they were, it was good-hearted that what my relatives were doing, but I was just sitting here looking at these videos and I'm like, there's a lot of people in these videos that you're picking up. It's kind of an unnerving kind of situation, because I knew if that was our mother-in-law there, they wouldn't want her film, as people walking around.
Yeah, I don't want to sound like it's not that important to me, but just people walking around in common areas doesn't give me a whole lot of heartburn. If you're going into individual rooms, looking at charts, looking at people with wounds or treatment, undergoing serious, if doctors are giving advice, that worries me a little more because of the type of information that's being captured. I don't know, does anybody else want to chime in on that? No one wants to touch it. All right.
Question too. You mentioned the notification for video.
Yeah.
Let's say if I want to set one of these up in my house with audio, if I put a sign up that said you're going audio and video recording, does that remove the expectation of privacy if people come in, or?
If the signage is good enough, yeah. I mean, to me, it's like when you call in and the voice on the machine says your call may be recorded for quality control purposes. You've been told that it might be recorded, and if you continue to proceed, it's implied consent. Now, if your sign is a little tiny sign in the corner, no one sees it, and that goes back to the point that why are you recording it? If you're recording it because you're trying to keep people from doing something, you want to be, without having your signage dominate your decor, you want people to know that you've got that camera. I was talking to somebody about that yesterday, telling them about this event, and they were talking about putting some cameras in their barn that they have. And they were talking about hiding the cameras. I said, why wouldn't you make it very clear to, unless you're trying to catch a deer and shoot it, you want to deter people. You want people to know that they're being recorded so that they'll have that expectation and that they might act in a different way.
And Amazon requires it, by the way. If you get the Amazon delivery in your house, they require you to have the camera. I need to put up a sign.
Yeah. So, one more thing, I don't know if I mentioned this. If you've got something like a Nest and it's putting the data in the cloud, there is a lot of guidance from OCR, from HHS about cloud storage with EPHI. So that's a whole, again, separate conversation for a whole other day. But there is some very clear guidance about things you're supposed to think about, what goes into your risk analysis, encryption, backups. One of the things on the cloud is like the availability. I think a lot of people forget about that aspect of it. Even internet, like cloud providers will sometimes threaten and say, hey, if you don't pay, I'm not giving you your data. You don't have the right, if you knew, and the business associate agreement should say this, but you don't have the right to tell the person that's giving you the medical information that they can't have it back. That's a HIPAA violation by that business associate. There's very clear guidance on that. More than one occasion I've had to write a letter or make a call and say, do you really want to guarantee that we're documenting your HIPAA violation here? Because if you just, if we can work through this, then maybe it's not an issue, but if we can't, then it definitely is. all that goes, I think, to having a good business associate agreement. Should be clear in there that they're not allowed to cut off access. So if you've got that in writing, hopefully it's not even an ambiguity. Anybody else? Comments before we keep going? So real quick on state privacy laws. There's a lot of them, right? So we can't cover all of those. You might, be able to walk us through all of those quicker than me. But there are a growing number of states, I think there's close to 10 now, that expressly permit in the statutes, not Florida, but other states which expressly permit patients to use webcams in their nursing facilities. Now, those statutes usually don't relate to hospitals, but there's an increase in a lot of attorney generals really thinking hard about whether or not this is a patient right. And a lot of people are saying, yeah, you do have a right to have a camera, and if you want to give up your rights to have your healthcare information streamed to the world or streamed to your family members, then you can do that. And the institution, it's against the law for the institution to tell you no. So that is where, I think in those kind of states, that's where a healthcare organization really needs to think long and hard about, do we want to come up with a way to allow this to happen in a way that we control versus a way that everybody and their nephew bringing in their Nest cams, suddenly we got a huge set of hornet's nests of the problems on our hands, and we can't control them, we can't manage them, and keep that risk to a minimum. New Jersey is really interesting. They have a program called Safe Care Cams. You can call the Attorney General in New Jersey if you're a New Jersey resident and you're worried about elder abuse. They will literally send you or give you a covert spy cam with a memory card in it that you plug into the wall. Looks like a phone charger. They have a couple of different variations on it. And the Attorney General will give you the camera and encourage you to record the abuse. So, I mean, that's a far cry from our state where you'd have to have consent to record the audio, right? So even though New Jersey doesn't have a statute permitting the recording, the fact that they're giving out these cams suggests that they're probably not going to prosecute you if you do it, right? So,
Or in New Jersey, they mean.
yeah, who knows? Yeah, I am surprised actually that we don't have more protection, more some kind of statute allowing this in the state of Florida, considering how many of the people that we have here are older in population. So I don't know if maybe the lobbyists are doing a good job. The healthcare companies have good connections and they're keeping those laws from being passed. But I think there are close to 10 states that allow this to happen. So there are plenty of people out there having to deal with this problem, whether they want to or not, from a healthcare organization standpoint. So it's for someone to say, "Oh, this can't be done. It's never been done." That's not true, at least not anymore. And definitely not New Jersey, right? One other thing I wanted to flag real quick. A lot of guidance, if you Google it, you come up with this. There's this federal statute. It's 42 CFR 48310. There's no private cause of action here. These are the requirements that an institution has to meet to qualify as a skilled nursing facility under Medicare. Right? And there's all kinds of rights that people in a nursing facility have under these regulations. They can't be, Morgan & Morgan and Farrah can't sue you under that statute, but it does establish a baseline of what the organization is required to comply with. So if you're a healthcare organization, you don't want to be put in a position where you're refusing to comply with the requirements that allow you to get the Medicare payment reimbursement that you want to get from the people you have in your facility. So there's some ways to use those regulations in conversations and trying to get people to be more flexible in what they're willing and not willing to do. I think there's a lot of good arguments buried in those regs about a patient in a long-term care facility having every right in the world to do exactly this. So then it becomes the issue of, well, do you want my nephew to do it, or do you want to do this your way and do it in a way that you can control a little better? I know we're getting a little short on time here, so let me cover just a couple more things. I put together this slide. I don't know if you can see it. Up here you got like the patient, right? And then you've got the healthcare worker treating the patient. You've got some family members the best I could find for footage of two people, older people, apparently sharing a facility. So the point of this photo is that, look, you've got a lot of different, forget about the legal stuff that we just talked about. All of these people pictured here have privacy rights, right, and privacy concerns. The patient certainly has the most privacy to give up if you're using webcams, right? Their fairly confidential and personal information is now being made available to someone, and potentially is more at risk of getting out to the public. But you've also got rights, these people that are helping treat patients, they're coming in, they might not want themselves being recorded. So you've got to find a way to address the concerns of people that are working in those environments. Perhaps there's ways, this works for patients and for providers, maybe there's times when you turn those cameras off. Maybe it's a temporary thing. There's times when it's as easy as covering them up, right? But maybe there's a more formalized way to have a policy where if any of these people need some time when the camera needs to be off, that it can be done in a way that's documented and appropriate. Because otherwise, if you're just flipping it off or covering it up, now you've got the allegations coming back that you've got abuse, right? Oh, well, they're just covering it up and then they're doing the bad stuff and then they open it back up. So all of this to say that this is a complicated kind of thing. It's not, you can't just say, well, what is the patient's privacy? They're not the only ones in that room being affected. I think the one that people forget about a lot is guests. People coming in to visit people. Hopefully, if you're in a nursing home, you're getting visitors. But those people aren't going to be aware, even if the patient has consented to having the camera. People that come and visit, they might start talking about Aunt Sally or Uncle Joe or all the different stuff that family members talk about. And suddenly, all that's been recorded, and they didn't know that they were being recorded. And if you're recording audio, did you get their consent? So some of that goes back to the signage that you have. Or a lot of these facilities, you check in. You could have a little sign right there, or make it very clear to people when they check in. Hey, the person checking them in could say, all right, your family member is in a room where there's a camera. Just need you to know that that's there. Don't forget. I think that would go a long way to addressing, the rumor mill being recorded on the video and being used at some point down the line. Let's see, what else did I want to cover on this? So I think the best way to address all of this is to inform people about what's going on, and if possible, get consent. You don't always need consent, but information and consent goes a long way to managing people's expectations of what they thought was going to happen and whether ultimately you're going to have liability. You're never going to be able to prevent potential issues with people hacking in, taking stuff. Those are always a possibility. But it's the bigger idea of, did people have a reasonable expectation of what they were going to get when they went into the room that had that camera. A couple cybersecurity issues to think about real quick. We talked about, did this before, the use of a private or shared network. If you're going to use, you may need to come up with a separate network to connect these devices to. That's one way to segregate the data off. So if someone were to hack into one part of the provider, one part of the healthcare institution, then you wouldn't necessarily get to the cameras. Storage of video recordings in the cloud. We talked about the guidance that's out there from OCR on that. But that really is something that needs to be thought about and dealt with, and include the disposition of that information. When do you get rid of that? You've got medical information in there. How soon, even if you wanted to, how soon is it appropriate to get rid of that information? Ability to access video and other information remotely. That's the issue where you've got family members that have access. You've got other people coming in. How soon and how able are you to cut off and control the access so that people aren't accessing other people's protected health information that they shouldn't be getting to? And then I guess I talked about this too earlier, the updates for IoT devices. They're not automatic, usually. A lot of times you have to force that to happen. And then I've seen some really scary stuff lately, that these devices, that they're configured to accept updates in a certain way, but that just means the bad guys figure out how to mock the update, and they can deploy any kind of bad thing that they want by simulating an update. And a lot of times, the cheaper devices especially, they're not rigged with a whole lot of protection for someone trying to do really bad stuff. And so the manufacturers haven't thought about that. The software developers haven't included that. And so just something to think about. That's a question you would ask before you would buy the devices. What kind of updates are available? How are they done? And what kind of security is available for the updates to make sure that they're only the correct updates. Couple last practical considerations, and then I'll let you guys go, or you can ask questions. To me, the issue is you've got healthcare providers that have a huge amount of risk. They know they got a huge amount of risk. They don't really perceive there's a huge benefit to offering these cameras, unless they've had a family member where it helped them, or like us, we had an experience that it really was helpful. I think a lot of people would say, huge risk, very little benefit, we're not doing it. But on the patient side, it's the opposite of that. There's not a huge financial cost. And depending on how much you value your privacy, there's not that much you're giving up in terms of privacy in exchange for what could be a huge benefit. If you really think your family member is being abused, or if you're being abused, that may be your only way to be able to either prevent that from happening or to prove that it happened. And so somewhere in the middle here, you've got all these different people, the patients, family members, the guests. I think you've got to, if people are pressing for it, I think there's ways to come up with solutions that work, that are HIPAA compliant, that aren't illegal, but that also